Our next bill on the agenda is House File 3954 from Vice Chair Frederick. If you'd like to come down to the table to move your bill, I'm hoping to be done by about 1:45. We'll allow 30 minutes for this bill right here. Vice Chair Frederick, if you'd like to go ahead and move your bill.
Thank you, Mr. Chair. I move to lay over House File 3954 for possible inclusion in the Human Services Policy Omnibus.
Okay, Vice Chair Frederick, I understand you have an author's amendment, the A2. Would you like to move your A2 amendment?
Yes, Mr. Chair, I'd like to move the A2 amendment. What it does is aligns the bill with a similar amendment that the Senate took, and it also extends the deadline till January of next year.
All right, very good. So, members, any discussions or questions to Vice Chair Frederick on the A2 author's amendment? Representative Baker.
Mr. Chair, Representative, good amendment. I'm glad we're adding this to the conversation today, so I hope we can all support that. Thank you.
Very good. Any further comments or questions? Hearing none, all in favor of approving the A2 author's amendment signify by saying aye.
Aye.
Opposed, say nay. Motion is approved, and House File 3954 is amended with the A2 author's amendment. Vice Chair Frederick, if you'd like to go, if you'd like to please begin explaining your bill.
Thank you, Mr. Chair and committee. I just want to actually say part of that amendment in extending the deadline is because of advocacy from Representative Baker. So I just want to thank him for his assistance on this bill as well. But I also want to thank everyone that's been involved, whether that is from the MASH and the sober homes, from the Harm Reduction Coalition, to even some local doctors from my district that came up from Mankato to advocate for aspects of this bill, not even knowing this bill existed. They were advocating for the content in this bill. The bill does two things. One is very simple. Sober homes are required to have Narcan or some sort of opiate antagonist in that space. However, there's no statute that says it has to be in a very clear, easy to access place. And so this bill says it needs to be in a spot that's not hidden in some cabinet somewhere in the house. So that's the simple part. The second part, though, tries to establish best practices by allowing medication-assisted treatments and not just it allows for medication-assisted treatment, but it also allows for medication for co-occurring disorders, trying to look at as people as a whole person, that multiple things can be going on, and to be able to help people with their recovery journey to allow them to have access to those medications while in a sober home. There is some concerns that were brought forward that some people are advocating for sober homes to be completely sober. Meaning nothing in them. And it's a fair critique. There's nothing about this bill that is looking to eliminate anyone's individual path to recovery. We all know that can look different for every single person who's in recovery. But an argument saying that sober homes need to be completely sober, where over 70% of them are already allowing some form of medication-assisted therapy, means that they're already not sober. And so what this is looking to do is to expand on that and again, allow for medications for co-occurring disorders. And I just want to state again that there is, in a sober home, if you have one person that is taking some sort of medication-assisted treatment and you have another person who's not taking anything, those two things don't negatively impact each other. They can proverbially walk side by side in their recovery journey, and I just want us to recognize that too. And with that, Mr. Chair, I would say we can turn it over to testifiers. Okay,
very good. I understand we have a number of people who are looking to testify today. I'd like to let folks know that we will be having a 2-minute limit on testifiers. So the first person I have is Edward Krumpatich. If you'd like to come down, please, to the testifier table. And then after Edward will be Wendy Jones. Welcome to the committee. Thank you for taking the time to be here today. Please introduce yourself and begin your testimony.
Esteemed members, thank you for having me today. My name is Edward Krumpatich. I'm the chair of the Minnesota Harm Reduction Collaborative. The state of Minnesota saved my life. Despite being a former Maryland State History Teacher of the Year, a master's graduate, and a college athlete, I found myself in the grips of substance use disorder, battling homelessness on the streets of Minneapolis for about 6 long years, facing the devastating reality of HIV. Substance use disorder doesn't discriminate. It takes the lives of families, friends, and countless neighbors. Minnesota has invested millions of dollars in my care, 40-plus abstinence-based treatments, 25-plus detoxes, numerous hospitalizations, surgeries, and 20 stays in abstinence-based sober homes. It wasn't until a medical provider provided me co-occurring disorder medications, which acted both as a safe supply for my use of methamphetamine and also a co-occurring mental health disorder. I take a stimulant to treat a stimulant use disorder. I want to thank that doctor for thinking outside of the box, and I want to thank the state of Minnesota for paying $30 a month for that care, compared to the upwards of $10 million the state has paid, and compared to abstinence-based care. Let me share some crucial insight. ADHD, for example, increases the risk of someone developing substance use disorder by 5 to 8 times. I was an untreated youth. Treating ADHD is straightforward with best practices. In fact, all we're asking to do in this bill is to follow SAMHSA guidelines. Currently, sober homes in the state of Minnesota numbered about 200 with about 2,000 beds. There were 12,000 admissions, 12,000 people admitted for opioid use disorder in 2021. That's 2,000 beds for 12,000 people. And medications for opioid use disorder are the gold standard medications for opioid use disorder. There is no if, there is no but, there is no anything. Think insulin to diabetes and statin for heart disease. We would not deny our grandparents insulin, we would not deny our grandparents a statin, and we wouldn't deny my brother, who is no longer with us, a chance. But wait a second, we did. He didn't have the chance that I had. Neither did my friend Nico, and neither did my stepdad, who I just lost. We need to do something about the abstinence-only abstinence-only restrictions, and open up the market. Thank you.
Thank you so much for taking the time to be here and sharing your experiences with us. Next is Wendy Jones, and after Wendy Jones, I have Dr. Ryan Kelly. Welcome to the committee, Ms. Jones. Thanks for being here. Please introduce yourself and begin your testimony.
Thank you so much, Chair Fisher and committee members. My name is Wendy Jones. I'm a person in long-term recovery from substance use disorder and the executive director of the Minnesota Alliance of Recovery Community Organizations, or MARCO. MARCO and recovery community organizations advocate for recovery-oriented system change. We reject the shame, stigma, and discrimination that have historically harmed our communities, and we are community advocates across the continuum of care, which is why I'm here today. I am testifying in support of HF 3954 for 3 reasons. First, substance use disorder is a chronic disease, and people in recovery want, deserve, and are legally entitled to parity with the care afforded to other chronic diseases. People who use medications for opioid use disorders as they are prescribed are protected by the Americans with Disabilities Act, or ADA. The recovery community fought long and hard for inclusion in the ADA, and it is the recovery community's responsibility to uphold and to advocate for ADA protections for all its members. Second, we're in a time of great change. The science of addiction and recovery has advanced exponentially over the past quarter century, as has the nature and availability of substances that are killing us. Last year, our practices are changing across the continuum of care to reflect the world we live in today. Last year, SAMHSA released best practices for recovery housing that recommended operators not have any barriers or restrictions for residents to use prescribed medications for behavioral health or physical health conditions. SAMHSA also included specific strategies for recovery housing operators to integrate access to prescribed medications into existing environments. Finally, recovery is not a zero-sum endeavor. There are multiple pathways of recovery, and practicing one pathway does not take away from another. 12-step, abstinence-only, medication-assisted, and all the other recovery pathways can and must coexist if we are serious about addressing the addiction epidemic. Segregation of recovery pathways and recovery supports does not ensure equal access. Thank you.
Thank you, Ms. Jones. Next, I have Dr. Ryan Kelly, and then after Dr. Ryan Kelly, I have Randy Anderson. Thank you for taking the time to be here today. Please introduce yourself and begin your testimony.
Thank you for having me. My name is Ryan Kelly. I'm an internal medicine and addiction medicine physician. I work at the Community University Healthcare Center in Minneapolis. I'm also co-director of the Addiction Medicine Consult team at the University of Minnesota Medical Center. I work every day to increase access to people who are unsheltered, don't have telephones, don't have transportation. For my patients with substance use disorders, access to proven life-saving medications like methadone and Suboxone are key. For my patients, the harder it is to access housing, the more likely they die. For my patients, the harder it is to access these medications like methadone and Suboxone, the more likely it is that they die. Hence, making someone choose housing over these medications is beyond harmful. You know, as we've already heard, some people think of meds like methadone and Suboxone as replacing one addiction with another. So to emphasize their importance and argue against that, I'm going to make an analogy. You know, think of antibiotics. You know, back before antibiotics had been discovered, if someone had a serious life-threatening bacterial infection, yes, some people may fight it off, they may recover on their own, but many patients would die. Well, now that antibiotics have been discovered, if someone has a serious life-threatening bacterial infection, you know, risking death to try and recover on their own makes no sense. And when it comes to patients with substance use disorders, especially opioid use disorder, numbers even worse. Without access to medications like methadone or Suboxone, someone with opioid use disorder, well over 90% of people will relapse over time. They will not recover. Hence, I want to emphasize the importance of these medications and that forcing people to choose housing over these medications is harmful. And then finally, I just want to really emphasize the importance of easy access to naloxone. Thank you very much.
Thank you so much for your testimony. Next, I have Randy Anderson, and after Randy Anderson will be Will Lycan. Thank you for being here today. Please introduce yourself and begin your testimony.
Thank you, Chair Fisher and committee members, for allowing me to testify today. My name is Randy Anderson. I'm a state licensed alcohol and drug counselor, a board member for the Minnesota Board of Behavioral Health and Therapy appointed by Governor Walz, a peer recovery specialist trainer, and a supervisor. More importantly, I'm a person living in long-term recovery, and what that means to me is I haven't used drugs, alcohol, or any mood-altering substance since January 9, 2005. None of the above mentioned would have been possible if I hadn't been offered treatment for my substance use disorder while on federal pretrial release awaiting sentencing for my drug-related crimes. Initially, I didn't seek treatment to find recovery. It was simply a means of avoiding jail time. However, over the course of 10 months, within what was initially intended for a 60-day treatment program, something clicked, and I found myself on the path to recovery. During my participation in that treatment program, I resided in a safe, chemical-free environment where medications like Valium, Xanax, Ambien, Vyvanse, Adderall, and other highly addictive prescriptions were prohibited or inaccessible. I feel immensely fortunate that such a supportive environment existed because had any of the fellow residents possessed those medications, I recognize that I would have attempted to obtain and misuse those medications to fuel my own addiction. There was an A1 amendment, which didn't go through today, but I feel with that amendment chemical-free housing would have continued to be a available resource, providing individuals like me a safe haven. However, under the A2 amendment, this crucial option could be lost, and I strongly believe it would result in more harm than good. Opioid overdose deaths persist at alarming rates, necessitating a comprehensive approach. Research from the National Institute of Health indicates that medications for opioid use disorders such as methadone and Suboxone can reduce overdose deaths by 30 to 59%. Therefore, it makes logical sense that all sober homes permit these medications. In today's discourse, we emphasize the concept of multiple pathways of recovery, celebrating all routes individuals may take. If we truly embrace and understand this principle, it is my personal and professional opinion that the current bill, either on its own or with the adoption of the A2 amendment, fails to honor my pathway, my recovery, my choice, and that of many others. Eliminating a choice or pathways to recovery runs counter to our ideals. Let's ensure we preserve diversity in recovery options. Thank you for your time, attention on this important and very personal topic.
Thank you for the input. I will mention that we do have the A1 amendment that will still be coming up after we are done with our testimony. We do have one more testifier before us right now. Will Lycan please come down? Thank you for being here today. If you'd like to please introduce yourself and begin your testimony.
Thank you, Chair Fisher and committee members. My name is Will Lycan, and I'm the Executive Director of the Minnesota Association of Sober Homes, also known as MASH, a nonprofit dedicated to certifying, inspecting, training, and supporting sober housing in our state. We enthusiastically support the A1 amendment. However, we are opposed to the unfunded mandate in House File 3954. A one-size-fits-all approach to recovery will not work. If the state wishes to support medication-capable sober housing, there are many better alternatives besides mandating another model out of existence. States such as Indiana, New Hampshire, and others have robust offerings for medication-supportive housing through incentives and training. I'd like to pay attention specifically to medication capability because admitting them is one part of it, while being capable to supervise is incredibly important. Medication capability includes verifying prescription, ensuring HIPAA compliance, suppressing medication diversion, counting medications, and destigmatization training. It is absolutely critical that we all embrace a yes-and approach to recovery. Every recovery journey is unique, with many variations in structure, faith, program, and medication. Preserving the choice for an individual to reside in a home free from addictive substances is incredibly important. There is a need for more high-quality sober housing capacity in Minnesota. Once this is addressed, there will be plentiful options for individuals utilizing all medications and for those who wish to be in an environment free from addictive medications. Moreover, the environmental scan on sober housing has not been carried out. Having data on medication usage in sober homes should be a prerequisite to any drastic legislation or mandate. MASH has provided a one-pager that includes preliminary data that we have gathered from MASH-affiliated organizations, as well as a diagram illustrating the NAR levels of homes. I'm happy to answer any questions you may have regarding that document. Many NAR Level 1 and 2 sober homes in Minnesota are not properly equipped or trained to effectively oversee addictive medications. Their quality may be compromised, or they may end up having to close their doors. Any reduction in sober home beds in the state is a lethal danger that must be avoided. MASH is committed to and capable of ensuring that sober homes in Minnesota have adequate training, oversight, and support. We must embrace person-centered practices that allow for consumer choice, small businesses to thrive, and for all recovery residents to have the support they need to thrive in recovery. Thank you very much.
Thank you so much for your testimony. Are there any other testifiers that would like to address the committee? I see several out there. If you'd like to come down to the table, and the second gentleman, if you'd like to come down in line here. You have 2 minutes. If you'd like to please introduce yourself and begin your testimony, please.
Chair Fisher, committee members, my name is Chris Edrington. I'm the owner of a company called St. Paul Sober Living. I operate 105 beds in sober living, mostly in Minnesota, some in Colorado. I'm in support of this bill. Representative Frederick and Baker have been super helpful with us at MASH. I'm also on the MASH board. And I want to acknowledge that we are in discussions, and it's been really, they've opened their doors to us, and it's been great. I want to address a couple of things specifically. When it comes specifically to medications in sober homes, I want to make it clear that MASH member operators are not against it. I don't know that there's a sober house resident in Minnesota not on some form of medication to treat their addiction, mental health, or other needs. When you hear MAT, or medication-assisted therapy, it often usually refers to medications like Suboxone, Sublocade, Vivitrol, and naltrexone. These have been very helpful to thousands. We are not against MAT. There are many drugs that are regularly prescribed by physicians to help those in recovery with co-occurring conditions. We are 100% in favor of these and effective in treating our people. We are for anything that helps us with this horrible, deadly, awful disease. There are hundreds of sober home residents right now in St. Paul doing quite well accepting MAT, and those residents would have otherwise not made it very far. There are some medications that can be problematic for the residents of some homes. These meds are not necessarily considered MAT, prescribed specifically for the help with addiction. Often they are prescribed for disorders or conditions like depression, anxiety, and ADHD. Of course, we understand the need for these meds. We encourage our residents to use the amazing mental health resources here in Minnesota. We have years of experience with some issues with these drugs. So to keep everyone in the home safe and comfortable as possible, early sobriety is messy, it's not easy, and there are a lot of pitfalls. We are asking to have all options available, to have choice, to allow some homes to decide if a particular medication is not a fit for their population. Again, this is not in any way a rebuke of the doctors who may have prescribed them. There are simply some medications that create a difficult context for some in early recovery. Some of you may not know, but have had...
Excuse me, I'm sorry. We hit the 2-minute mark. If
Okay.
you could give a concluding sentence,
I
please.
will. I just wanted you to know that I'm also the vice president of NAR, which is the National Association of Recovery Residents, and MASH is a state affiliate of that national organization. There are 30 other states that have MASHs doing this stuff very well. We have lots of resources, lots of experts, and we can bring that to the table to help figure this one out.
Thank you so much. I appreciate that.
Okay.
And then finally, Welcome to the committee. Thank you for taking the time to be here today. We do have a 2-minute limit.
Fair enough. My name is Eric Smedstead. I'll give you my qualifications. One, I'm a U.S. Air Force veteran. I'm a manager and director of 4 recovery homes, St. Paul Spirit House. I'm also a CPRS. I also advocate for guys in court. I'm certified in harm reduction. I have well over 1,000 hours volunteering directly in the recovery community, and I was the only manager involved in the 2023 sober home study. And more importantly, I'm very involved in sober living today. I'm mainly going to talk about the A1 amendment, which is coming up. So that amendment proposed does best represent recovery today when we talk about person-centered and culturally responsive to an individual's recovery needs today. What makes this amendment a solution is that it opens up more recovery paths when it comes to recovery homes for people suffering from SUD, and also gives them a choice when searching out a recovery home that best fits their recovery path and needs. The other important issue of culturally responsive is covered with this amendment, as we are not just talking about our native culture, but the culture of recovery in the home itself, which is vital in terms of successful recovery in a recovery home. I also believe that sober homes can still keep the models that have proven to be successful in recovery while supporting SUD and MAT treatment without the worry of addictive medications being brought into the home that residents may have abused in the past, which could be a triggering scenario. The amendment also helps an area which I don't hear much about. It's giving referring agencies more options for clients when searching out a home. This is one of the major problems of being able to give a number of choices to a client on their particular need, is when it comes to person-centered practice of recovery, when the path requires medication. This amendment will save lives, and also keeping the option of choice for the most important part. It comes to recovery of the person. I would also like to state that I do not have stake in ownership of recovery homes. I am a resident and a manager. I am here today for the residents only. I believe that we need to give residents the best opportunity possible for recovery, especially when it comes to recovery residents. I am in support of the amendment based on it gives people like me a better opportunity for recovery while still keeping people's choice alive. And one more. If there's anything I can do to help this body understand recovery living better through thousands of hours of lived experience in the community, I freely would volunteer my time. I would also like to thank Representative Baker for the amendment proposed today. This amendment will save lives. Thank you.
Welcome. Thank you so much for your testimony, sir. Next, we will now go on to dealing with the A1 amendment. Who will be offering the A1? Representative Baker.
Thank you, Mr. Chair. And again, I want to thank Representative Frederick for bringing the bill forward. I signed on this bill for a reason. It's important work that we're doing to bring the reality of the therapies that are available today to the world of recovery. And again, my signal to the communities that I work with a lot, and I've been to a number of sober homes, is that not one is the same. I think that what I've learned after listening to a lot of different people in that is that, like my journey with understanding what is this medicine that's helping people stay sober. This is a big deal. This methadone, Suboxone, Vivitrol, it's all really important. But what also there is, and again, to the case of this, there's also medications that help people in recovery, like more addictive type things like Adderall and other anxiety medicines and things. Here's where we're at in this with the whole world. And I've been on the phone a lot this weekend, also with Representative Frederick. So we're talking about this, and we're going to get this right. But I wanted to make sure the A1 was offered today. I hope it can be accepted to go forward, because this needs to be part of our conversation. But what I'm trying to do with this amendment is make it all the therapies are part of this. We're not arguing that at all. It's just, it's allowing a sober home, though, to carve out some areas that they're not happy with or they're concerned with. Some homes don't have the management levels or the oversight that others do. And we have to recognize that as the real world out there. These sober homes are very fragile, and they are the first, sometimes one of the most critical parts of a person's recovery after in treatment. We need to make sure that we listen to our owners and our managers like we've done today. And I just want to just offer this up, that I'm still supporting this some way, but it took me a while to get where I'm at with the therapy treatments and how it's really working. But right now, these folks are saying, on this little piece of it, let's hold off on this. So I think we should take this forward. I hope the committee accepts the A1 because I think it's a small percentage of the people right now that are in recovery using these addictive type things. Again, I'll use the Adderall for an example. It's important for some people to use. I'm not saying it's not. Right now, today, 68% of our sober homes are allowing treatments, therapies into their homes. Not everybody, but this bill will get everybody in this, at least on that core therapy method, okay? So I think that our sober home world has come a long ways that way. So I hope that the author will look at this as a very friendly amendment. Again, we are committed, I know Representative Frederick and I, to get this right. I think this part of this conversation will be helpful, and so I offer this up for discussion, Mr. Chair.
Okay, very good. I'll go to Vice Chair Frederick and then Representative Edelson. Vice Chair Frederick.
Thank you, Mr. Chair, and thank you, Representative Baker. This is a space that I really enjoy working with you on. You have a different kind of thought process for some of this than I do, which is, I think, valuable. I want to say before this bill, from where Minnesota currently sits, this amendment moves in the same direction as my bill, right? We're moving in the same direction with this amendment or without this amendment, and I am grateful for that. I think what the difference between what my bill does before versus after the amendment would be just how far that we go down that path. So with this bill getting laid over, one of the things that we talked about this morning and that I'm still committed to is we've had lots of conversations. Representative Baker and I have had lots of conversations with the sober homes, with all these different stakeholder groups. And one thing that we haven't done is pull literally everybody into the same room. And so one thing that I'm committed to doing is I know we have a very short timeline because it's hard to believe how far we are into session already, but getting that meeting set up, getting everybody at the same table and trying to work through and trying to tweak the language as much as we can to improve it as much as we can. I don't know how that amendment necessarily would align with some of the things I did with my amendment. So for now, I would say, I would ask the committee to vote down the amendment, knowing that, there's going to be a meeting set up. If there's a way to improve it, I'm committed to improving this more in the future. And that's an invitation to everyone else too, that's in the room, that's testified on this bill. I think it's important that both sides hear each other, and I'm committed to making the improvement where we can.
Okay, thank you, Vice Chair Frederick. Representative Edelson.
Well, thank you, Mr. Chair, and thank you, Representative Frederick, because I was just going to say, my sons have ADHD. They need Adderall. And when they don't have it, they don't operate in the way that works for them. So as a therapist, I would have real concerns if we're having this discussion and a prescriber has prescribed something, a medical doctor, and we're going to say you can't, that's not included in sobriety. Now, you could argue Adderall is addictive, or you could argue that it's not. I think in both frames, I'm glad that you're going to pull everybody into a room, because I love that. That's my favorite thing to do. Yep. Pull them all into a room and make sure a doctor is present, because we're talking about co-occurring issues. People oftentimes get involved, or they get into addiction because they're medicating. And so I just want to make sure that we have some medical professionals in there as well. Thank you.
Thank you, Representative Edelson. Before I go to Representative Baker, I just want to say that, yes, I do know that we've got deadlines on getting the first bills out next week. I'm happy to hear that you're going to bring everybody together. I would like to say, though, even if we don't quite get this done by next week, that whatever the bill is that this is incorporated into, we'll continue to work going forward, because this will go to the House floor and we can still make more changes from there. So I do want to encourage people to continue to working together on it. And with that, I'll turn it over to Representative Baker for any final comments.
Yeah, and thanks, Mr. Chair, and others. I think Representative Edelson said it well. There's nothing wrong with folks using Adderall and other things like that. That's not what I'm intending to say here. But there's not 100% of the homes are ready for this, because it is a very addictive style of a drug that can be abused easily. And they see this firsthand in these sober homes today. The problem is that the bill mandates 100% of our sober homes to do this. I'm just saying, let's walk before we run. Because right now, 60% of them likely are okay with taking the Adderall side of things, the whole package. Not all of them. This one-size-fits-all is not right for everybody. So while I'm really disappointed that we're not taking the amendment at least to further conversations to send a signal to our stakeholders on both sides of this issue, I think that's what we should be doing is like, okay, this is an option. When we get all done on the House floor, you may decide, Representative Frederick, that's not part of your bill. And then we'll have the vote the way the vote is. But it's not for 100% of the sober homes today are not ready for that, for everything. So I know we'll get to a better place. I'm disappointed that we're not going to accept the A1. I still want to see, I'm not going to call a roll. I really think this is important to see where the committee stands on this, but I want to see this move forward because I think this conversation will give an indication to the people that are doing this every single day, what is the committee going to do? And if we take it forward, members, we can always take it out later too. So it isn't like you're stuck. We're not. Let's be flexible. Let's do this in a bipartisan fashion, but this is what we should be doing. And I am so committed to working with Representative Frederick on this issue. I know he knows that. And so with that, I do hope that we will accept the A1 to take it further and in our commitment to working this better. But every single sober home in Minnesota is not ready for the full gamut. Thank you.
Thank you, Representative Baker. With that, all those in favor of the A1 amendment signify by saying aye.
Aye.
Those opposed say nay. No. The motion does not prevail, and the A1 amendment to the House File 3954 is not adopted. Further discussion on the bill as amended by the A2 authors amendment. Not seeing any. Vice Chair Frederick, any closing comments, and please renew your motion.
Thank you, Mr. Chair. What I would say is, to all the sober home stakeholders, one thing I do hope that they can say is that I have been very open about, and every question that I've asked, that there were no surprises here. I hope that they can say that because they know that I'm coming at this in good faith, that I really am trying to incorporate their feedback, but I also ask lots of questions. I want to highlight something that Chris actually said right here, and that's that sometimes it gets messy. I don't think anything else rung more true than that, and I get that. I think that there is a level of fear in this that I've sensed from people about allowing some of these medications, and that concern about it getting messy. But I want to say this too, is that even when sober homes started to allow more of those medication-assisted treatments, and I think in your words there was it got messy, but you worked through it, and I would, by all measures, these sober homes are incredibly successful still in what they're doing. I think that is going to be what happens, even if, with some of the fear that's associated with this, but I am committed to try to figure out what else we can do to make my bill better. And with that, I would just ask that the bill be laid over for the possible inclusion in the Human Services Policy Bill.
Thank you, Vice Chair Frederick. House File 3954 as amended is laid over.